So in 2017, we did a clinical immersion across India, visiting a lot of hospitals, and we found there is a unmet clinical need, which is the shortage of ventilators, and which is leading to manual ventilation. And in most of the scenarios where we have identified patient caretakers and being asked to manually bag the patient with this bag wall and mask, it is meant to be done for very specific short period of time for stabilizing. However, it's done for a prolonged period of time, which is leading to mortality and morbidity. And this was our need statement, and how can we develop something innovative, which is affordable, easy to use, low cost, portable, and standardized version of device which bridges the gap between existing manual ventilation and reduces all these, because when you operate this bag wall and mask, it has to be given at specific breath rate, tidal volume, and expiratory ratio. So we're talking about pediatrics and adults, and each patient will have different lung compliances and all these things. So very high skilled anesthesiologist, high paramedic who are trained enough to do this are required. And however, you see the patient caretakers in developing countries like India do this in desperate situations, and it has to be done in a specific way. So we have developed a device called RESPIRATORY. It's a portable ventilation automated respiratory assist device, which solves this problem, and it bridges the gap between the manual ventilation and existing high-end. On the other end of the spectrum, we are talking about big ventilators, which are like super expensive for normal, poor, low-income family or in the general population to afford the ICU costs. And that's where our device comes in, which can cater to these unmet clinical needs, can stabilize the patient in the emergencies, in the ambulances, between transit, or when there is outpatients, or when there is a shortage of ventilators during the situations like pandemics like Covid19, coronavirus. So we are in the process of tying up with various distributors and various partners across India and globally, so we can mass manufacture this portable device, so it can save millions of lives. So right now we are looking for partners who are interested to take our devices for mass manufacturing. So we could, for example, if a company in Italy or if a company in Germany is interested to tie up with us for licensing it out and for developing tons of these devices for the stabilization of patients at a lower cost, at a standardized way, at a way that it can stabilize the patient, because all these things are it can deliver automated breath rate, tidal volume, inspiratory ratio between if you're talking about breath rate, it's all standard, where 8 to 16 breath rate can be given, up to 22 breath rate can be given, and tidal volume up to 500 can be given, 500 to 700 can be given from 100, and inspiratory ratio 1:2, 1:3, 2:1, 2:, and so on. So the thing is, we have very simple features, but the simple features is very easy to use. So it because when you have a big crisis, and there are a huge chunk of people, and there is just one bus coming to take, and how is one bus going to take all the people, right? So we need, even if you make a lot of these flights, and you don't know how the pilots are going to take the flight, so there's no point. So that's why this simple devices are essential to use these situations. I would say preparedness. Preparedness is the most important thing, and we should have it's a very relevant question. In 2017, when I was in MIT Boston, I was doing a study on disease, the disease state modeling and how would this modeling happen. Because I was very interested how we could do a prediction before even some Ebola, epidemic occur, before even some SARS, or before even some coronavirus occurs. So we need innovations that keeps track of all these data and uses this to predict certain outbreaks earlier, so we can stop them before even happening. So we need that kind of a cutting edge technology to keep track of all the data, and we need to make sure that all the safety and people are more educated. We have more preparedness, and preparedness and prevention is both essential for disaster management. That's where our devices can be used in these disaster management. Stay safe. It's very important that to take care of our health, and I mean, I haven't slept in days, so very important to take food at the right time. And don't panic, or but just try to see how we can. I think there is hope for this to, we could come down. The epidemic will come down, and we're trying to get this contained, and we're working towards that. So for the general public, I would say, please make sure that your immune system, you take all the nutrition, you take all the precautions, keep it hygiene. Don't go outside unless it's super essential.